I'll begin with the first section, background of the hospital. Our case study focuses on Columbia Asia Hospital Bukit Rimau, a private hospital located in Bukit Rimau, Shah Alam, Selangor, Malaysia. The hospital provides healthcare services to residents in Shah Alam, Kota Kemuning, Klang, and the surrounding communities. The hospital vision is right here for you. Its mission is to deliver the best clinical outcomes in the most effective, efficient, and caring environment. There are no publicly available of the hospital organizational chart. Now that we have covered the hospital background, let's move on to the next section of our case study. Now, we will talk about the relationship between hospital and government. The hospital, while privately operated, is supervised by the Malaysian government to ensure compliance with specific regulation, licensing, and laws aimed at maintaining ethical standards and preventing malpractice. Columbia Asia Hospital Bukit Rimau adheres to essential regulations, including Personal Data Protection Act (PDPA). Furthermore, it is required to report any infectious diseases to Kementerian Kesihatan (KKM), facilitating a partnership with the government for monitoring and controlling such diseases and collaborating on prevention strategies through timely updates on infectious disease status. Now I'll pass it to the next presenter.
In this presentation, I will cover section 3.0, which explain the hospital service, package, and physical facility. Then, I will cover section 4.0, which explain the hospital core value. Let's begin by looking at the specific clinic and center. Let's look at section 3.0, which focus on clinic and center. Hospital Columbia Asia Bukit Rimau organize its specialized care into several key areas. First, cancer care provide highly professional treatment plans and advanced medicine to give patient hopes. Second, cardiac care feature both interventional and non-interventional cardiologists run by a dedication team of specialist cardiologists. Third, the integrated orthopedic recovery pathway ensure continued support after patient are discharged, preventing gaps in care and complication. Fourth, minimally invasive surgery use tiny cuts and camera to lower complication risk and help patient recover much faster. Fifth, pre-diabetic care focus on early treatment, which make pre-diabetes completely reversible before it turns into type 2 diabetes. Finally, the hospital offer corporate client service, corporate engagement, and health transformation. These are specialized channels that manage healthcare, account, and wellness program for corporate. Next, let us look at the section 3.2, which cover package. The hospital bundle its service into package to make healthcare proactive and easy to access. The first package is health screening. Health screening help identify disease before they become severe. Early detection help diminish risk for stroke, heart disease, diabetes, or cancer. Proactive check-up are highly recommended for everyone. Second, the physiotherapy package help both inpatient and outpatient reduce pain and get stronger. The physiotherapists work closely with orthopedic and sport medicine doctor to restore physical mobility and strength. Third, for dietary consultation, we always hear the phrase, "You are what you eat." A healthy, proper diet ensures our body gets the right nutrients to function well. Our custom dietary package can help prevent disease like diabetes and heart problem. Lastly, speech and language therapy is incredibly useful for patients of all age who have communication, voice, or swallowing difficulties. Therapists help diagnose and treat these issues step by step. Let's discuss section 3.3, facilities. This is the physical and operational backbone of the hospital. First, accident and emergency. Operate 24 hours a day to handle any urgent medical crisis, including severe pain. Second, ambulatory and surgical facility. Handle day surgery, meaning minor procedure where patient can safely go home the same day. Third, the clinical laboratory. Use advanced technology to test specimen like blood and tissue, helping doctor make fast and accurate diagnosis. Fourth, the clinic trial facility. Work with Clinic Research Malaysia to run oncology trial, giving cancer patient access to cutting-edge treatment. Diagnosis imaging. Use advanced scanner to look inside the body for accurate diagnosis. The pharmacy focus on safe medication use, keeping wait time short, and offering home delivery for convenience. Nursing unit provide 24 hours patient monitoring and emotional support to ensure patient safety and comfort. For corporate partners, occupational health service advise company and how to keep their employees safe at work. Finally, we have Cafe Columbia for healthy meals and the Columbia Kids Club, a play area designed to reduce stress. For last part, let's look at section 4.0, which is hospital core value. The culture and daily operation at Columbia Asia Hospital Bukit Rimau are guided by 6 core value, which is customer first. This means the staff always anticipate what patient needs and try to exceed their expectation. Excellent. The team is dedicated to deliver the high standard of care in every treatment. Teamwork. Doctor, nurse, and staff work together with mutual respect to achieve a common goal, the patient recovery. Integrity. This stands for honesty and a strict commitment to always doing the right thing. Caring. The hospital actively nurtures a culture of empathy and care for patient, their family, and the staff member themselves. Community. Columbia Asia stay closely involved with the local community to share knowledge and improve public health. This value makes sure the hospital is not just a business, but a reliable partner in community health.
We're going to discuss the client charter as on the official Columbia Asia website. We do the form and public client charter. Therefore, our case study refer to the corporate client services page as the closest public available information that reflect the hospital service commitment. The corporate client services focus on building strategic partnership with corporate organizations, insurance companies such as AIM Berhad, Allied Insurance, Azka Insurance, and more. While third-party administrator including MedCard Sendirian Berhad, Mediscrete Sendirian Berhad, Medicare Sendirian Berhad, and more. focusing on overseas third-party administrators including Europe Assistance CMN, Fullerton Healthcare, generally global health services and more. Although this is not a formal client charter, it demonstrates Columbia Asia Hospital commitment to coordinate healthcare support and long-term client relationship. Next is the hospital awards and accreditation. Columbia Asia Hospital Bukit Rimau is accredited by the Malaysia Society for Quality and Health, or known as MSQH, which is Malaysia National Healthcare Accreditation. This shows that the hospital meets recognized standards for patient safety, clinical governance, and quality healthcare services. Besides accreditation, our reports highlight only the award received during the past 2 years to present the most recent achievement. This award recognizes excellence in areas such as workplace safety, public engagement, customer satisfaction, and healthcare service quality. Together, these recognitions strengthen Columbia Asia Hospital reputation as a trusted private healthcare provider in Malaysia. For health tourism industry, Columbia Asia Hospital Bukit Rimau is not currently listed as an FHDC hospital. However, several hospitals under the Columbia Asia network, such as Columbia Asia Panjaya, Bukit Jalil, and Iskandar Puteri located at Johor, are already listed on the official Malaysia Healthcare Travel Council website. This shows that Columbia Asia Hospital already has involvement in Malaysia healthcare travel industry. For Bukit Rimau Hospital, the potential comes from its existing healthcare strengths. The hospital is MSQH accredited, located strategically in Shah Alam, and provides specialist services supported by modern medical facilities. Because of this strength, Bukit Rimau has a strong foundation to support healthcare travelers in the future, especially if it expands services such as international patient support, language assistance, and pre or post treatment coordination.
So next, I will explain the department missions, visions, objective, client charter, organizational structure, staff responsibility, and the facilities and services provided by the department. So first, let us look at the missions, visions, and objective of the medical records department. The mission of the department is to provide efficient, reliable, and confidential management of patients' medical records. This is achieved through professional practice, advanced technology, and continuous quality improvement. Next is vision. Vision is to become a leading medical records department that provides accurate, secure, and accessible health information to support quality patient care. And the department also has a several important objectives, which is these include maintaining accurate patient records, protecting patient privacy, providing timely access to authorized healthcare professionals, and managing both physical and electronic records efficiently. And they also supporting clinical and research activity, complying with healthcare regulations, and continuously improving service quality through staff training and new technology. So next is for client charter, which is the client charter explains the department's commitment to provide high quality services. The first commitment is to protect the confidentiality and privacy of patient information, and all patient records are treated as confidential and can only be accessed by authorized individuals. The second commitment is to provide timely access to medical records. This allows healthcare professionals to make quick and accurate decisions, especially during emergencies. So next is the department also ensure proper documentations by keeping patient information complete, accurate, and up to date. Next is for another commitment, which is to provide quality and prompt services. That means the staff members are expected to be professional, polite, and responsive to patients and healthcare provider. Next is the department also manage the proper storage, preservations, and retentions of medical records according to hospital policies and legal requirements. In addition, the department responds quickly to request inquiries, continually improve services quality through training and technologies. Now, let's look at the organizational chart. So, the department is led by the person in charge, which is followed by the head of department, which is under the head of department are the senior medical records assistant and several medical records assistants. Each staff member has specific responsibilities, but they work together to ensure that medical records are managed accurately, securely, and efficiently. And this organizational structure supports smooth communications and effective teamwork within the department. Are the job responsibilities of each staff member, which is the persons in charge oversees the daily operations of the department. The person ensures that all medical records comply with legal requirements and hospital privacy policies. And the head of departments manage the department's daily activities, supervise staff, and ensure compliance with hospital standards, and oversees clinical coding using ICD-10 and ICD-11. The senior medical records assistant supervises daily operations, monitor documentations, quality, and ensure that patient records are complete and accurate. Next, the medical records assistants, which is perform daily operational tasks. Their responsibilities include creating and filing medical records, entering patient information into the Care 21 systems, retrieving records for authorized users, scanning documents into the electronic medical records system, maintaining confidentially, and assisting patients with medical records requested. and together of staff or member play an important role in maintaining an effective medical records department. So next, I will explain the facilities and services provided by the medical records department. The first services is medical record registrations, which is the department register a new patient, assign a medical records number, updates patient information, and verify patient identity. And this help prevent duplications and identifications error. For the second services is medical record storage and retrieval, which is both physical and electronic records are stored systematically, allowing authorized healthcare professionals to access patients' information quickly when needed. Next is the department also use an electronic medical records or EMR systems, which is allow healthcare professionals to record, retrieve, update, and share patients' information electronically. This improves efficiency, reduce paperwork, minimize errors, and supports better patient care. For another services is clinical coding using ICD-10 and ICD-11, which is clinical coding converts medical information into standardized codes. These codes are used for billing, research, disease monitoring, and healthcare planning. Next, department also manage medical records confidentially and security by using password, access control, and user authorization to protect patient information. In addition, the department prepares various medical reports and documentations, including discharge summary, insurance reports, referral, and medical certificates. And for another services is release of information or ROI, which is medical record information is only released after verifying the authorizations document and ensuring compliance with privacy and regulation. The department also perform medical records audits and quality assurance, which is regular audits have improved documentations, quality, identity, errors, and ensure compliance with hospital standards. And the medical record department also responsible for record intentions and disposal, which is medical records are kept for the required intention period and are disposed of securely after that period ends. And finally, the department prepares statistical reports and health information management, which is these reports can support hospital management, healthcare planning, research, and government reporting.
Now I will talk about activities of the hospital records department. The record department is responsible for managing patient documents received from nurses, which must be submitted within a 24-hour notice. The department checks these documents for completeness, returning any with missing details to the nurses for correction. It also verifies the official stamps and doctor signatures are present. Once completed, the documents are sorted for scanning into the hospital cares 31 computer system, where they are processed to prevent duplication. After scanning, the documents are organized by the patient's medical record number, which is MRN, and stored into designated boxes. Active records remain in the hospital, while non-current records are sent to a third-party service, IMR541, for storage. Now, let's move on to section 8.7, the safety and security of the department. To maintain safety and security within the records department, access is restricted to the head of the records department, and there are 5 designated record assistants prohibiting entry to doctors and nurses. Medical personnel must request patient records through the front counter. Patients are also required to submit a request form to obtain their records for purposes like insurance applications. This systematic process allows the department to track records requests from both medical staff and patient. Additionally, a consent form is utilized to acquire written permission from patients for disclosing their information to third parties, such as insurance company, which may need these records for approving claims. Next, continuing with section 8.8, which is information technology application in the hospital. The hospital employs the Care 21 technology application for storing and scanning patient records. Developed through a partnership between Columbia Asia and Microsoft, Care 21 is designed as a cloud-ready hospital management system. Its purpose is to facilitate easier access to patient information by healthcare professionals, enhance collaboration between the hospital teams, and improve the overall patient care experience. Additionally, the hospital utilizes electronic medical records, which is ERMS, which serve as digital software to collect, store, and retrieve the patient health record efficiently. Our next topic is KKM Circulars, Health Act, Policies, and Guidelines of the Hospital Department. The record retention schedule at Columbia Asia Hospital Bukit Rimau detects that the incident reports are held for 2 years, while medical legal records are preserved for 7 years post-case closure. Adult patients' records are maintained for 7 years following the last visit. Newborns' records, however, are retained for 25 years after the last visit. Statistical records, primarily for operational reports, are kept for only 1 year. The hospital operational standards for record handling, storage, and third-party disclosure align with those of other private hospitals.